It's been 4 months since I started taking oral minoxidil for hair loss, and in this video I would like to share with you the news. First of all, we'll start with the side effects, whether they got any worse, any better, or remained the same as the previous months. Number 2, I'm gonna present to you my results from ECG, electrocardiogram, and also the analysis of my cardiologist and what he said about my results when I was taking minoxidil and did the test versus when I stopped taking the minoxidil and did the test. And lastly, I'm going to be sharing with you my hair situation while taking minoxidil for 4 months, and you can judge yourself whether it got better, worse, or remained the same. All that just for you to make the most informed decision on this medication, whether it's worth for you to take it or not. So make sure you stay tuned as always, and before we start, shout out to our sponsor GoFiber. These are hair building fibers you can use to mask any thinning or patchy areas on your scalp to make your hair look thicker and better. So make sure you check out the link in the video description below where you can visit GoFiber, get a free sample of your choice and try them out, see if you like them. I would like to share with all of the new guys that I'm taking a 1 milligram version. I'm not taking the 2.5 or 5 milligram version of oral minoxidil that many doctors and dermatologists could actually consider low dose still. This is not entirely my opinion, and that is why I am taking less than that. Now I actually decided to take a break from this minoxidil during this month number 4, for almost 2 weeks because I did the ECG test. More about it in a minute. The side effects I was able or unable to observe this month were pretty much the same as months before, so I do suggest you guys to check out my previous updates on minoxidil oral and watch them from month 1, 2, and 3 if you want to get a better insight into that journey, because there are also things that I'm not repeating in each of these updates, and there are always some new things that I'm mentioning during these each monthly updates, so check them out later, please. Now, during this month, I would just say that as far as hypertrichosis, excessive body hair growth, it's something that I'm noticing on my hands, especially here on my forearms, and also on my tricep and a little bit shoulders, so I'm actually shaving it off a little bit. I could imagine if I would be taking 2.5 to 5 milligram, the hair growth on the body would definitely increase even more. As far as my beard, some of you guys would maybe think that it's better or thicker or fuller. It just, grown a bit longer than I normally have. So I don't think there is that much thickening going on the beard, in my opinion at least. Now, as far as hair growth on the scalp, I'm going to be sharing this with you at the end of this video, sharing some photos and videos. I think that was it for the side effects. As far as the, chest pain or tightness, I didn't experience any of these problems, fortunately, during the month number 4. Although in the beginnings, I experienced a little bit, some glimpses of these things, but they usually, go away. They maybe happen in the beginning when starting a new medication, as it is with finasteride, when you get that weird ball ache and things like these, but then usually they stop over time when you keep using the medication. So this is my case as well. Most of this video I would like to actually devote to me sharing with you my ECG testing, because that's something that most of the guys who are jumping on the minoxidil oral bandwagon, also doctors and dermatologists, do not seem to promote guys getting the ECG before and then while they're on oral minoxidil. They just say that the risk of oral minoxidil changing your ECG or increasing the potential of some heart conditions is very low, so don't really bother with that. I don't have this opinion, that is why I did the test, and right now I want to share with you how these results turned out, analyzed by a cardiologist. Alright guys, so here are the 2 ECG or EKG tests I have done, spaced out about 2 weeks from one another. On the left was when I was not using oral minoxidil, and on the right it was when I was using oral minoxidil. Now, ECG is often used alongside other tests to help diagnose and monitor conditions affecting your heart. It can be used to investigate symptoms of possible heart problems such as arrhythmias, chest pain, palpitations like suddenly noticeable heartbeats, dizziness, or shortness of breath. Now, I did not experience any of these, side effects before, but I just wanted to know whether oral minoxidil intake on a daily basis is not altering some of these things. So I'm just gonna read to you the report from my cardiologist, who compared both of these tests to one another and came up with a conclusion. So the before test when I was not taking oral minoxidil was the following. The heart rhythm is 63 beats per minute. It's normal. Recording is without any arrhythmias, conduction or ST segment abnormalities. Normal interval. I also did the blood pressure check on that day. Blood pressure was normal. Now, on the test on the right side, when I was taking oral minoxidil, it was 55 beats per minute, called sinus bradycardia. This is already a condition when your resting heart rate is actually less than the normal range, 60 to 100 beats per minute. That's usually what athletes have, like swimmers, marathon runners, and this causes the heart to become more efficient, producing a greater stroke volume, which in return allows the heart to circulate the same amount of blood with fewer contractions. So that's what they have. This is what I also have on the test on the right. As you can see, if we zoom out, we will notice that on the test on the left, where I was not taking oral minoxidil, we have 10 different peaks. Okay, we have 10 peaks, and on the test on the right, we have only 9 peaks. That means that the heart is beating a little bit slower, and the whole page you can see here represents about 10 seconds of my heart beating on the left and on the right. Now, after having a further discussion with my cardiologist and comparing those results, he mentioned like, yes, you have a sinus bradycardia, the blood pressure got a little bit lower, but it's still kind of normal. He was also like, hey man, you're also doing a lot of cardio, you're working out, so it's actually quite normal that you have lower heart rate. Now, one important thing that he told me was that for any potential arrhythmias, the distance between these peaks, as you can see those, should be equal and they should be very regular. So this is something that he also, didn't find any issues with on the after test when I was taking oral minoxidil. So the peaks were completely aligned and there were very regular distances between each of these peaks, and these distances can be literally measured based on these little squares, and that's how they can measure the distance of each electric impulse of your heart in milliseconds, literally. So that's quite fascinating. That's how they do it. So fortunately, no signs of tachycardia, no signs of T-wave inversion or T-wave flattening. That's something that multiple studies actually found out. Among them, one study from Panchaprateep and Luengaran, and these physicians realized that by 20% of patients taking oral minoxidil 5 mg for hair loss, there was actually not only premature ventricular contraction, but also the T-wave inversion. And that means that some of the waves that you can see here got inverted. So they were not going like this, but actually like that. You can probably take that dose. One thing, however, that got changed significantly on the after result was actually the P wave. And the P wave is actually this wave that comes before that actual main impulse, that QRS complex, that's how they call it, the inversion of the inverted V shape. So the P wave, it's also very important. I read about it in the Journal of Cardiology, and ideally the P wave should never be flat or be inverted. So there should be always the P kind of a bump. And they actually say that the ideal P wave angle should be, the axis of the P wave should be from 0 degrees to 75 degrees. Now, my P wave before was 66 degrees and after it was 88 degrees. That means it's still in range, so that's considered healthy and normal. And also the duration of the P wave should be less than 120 milliseconds. So my P wave duration before was 132 and after it got to 98. But this is still in range, this is still considered healthy. So there was a change in the P wave, but it was not something that I should be worried about. At least that's what my cardiologist told me as well. So that was the result, that was the test. Long story short, how often should I do the ECG test in the future? That's also what I asked my cardiologist, and he told me it makes sense to do it like once a year if you are concerned. everything seems to be fine right now on the before and after test. Besides the slight lowering of the blood pressure, everything is fine. As long as you feel energetic, you are not feeling dizzy and whatnot, it's all right. And you should just keep doing this like once a year to monitor it further. All right, guys, and now let's talk about my hair, because this is something that most of you guys will be interested in, how my hair is looking. And here you can notice I'm not having any fibers, any products in my hair, just a little bit of dry shampoo. And this is how I style my hair, usually like up and to the side like that. And the front is transplanted, so no need to focus on it so much. I would like to bring the crown area to your attention, and you know, the rest of the mid scalp, which are the areas that are still kind of my existing hairs, and I try to preserve as much of that hair as possible, because I want to avoid having a hair transplant on these areas, since I don't have so much supply in the donor anymore. So fortunately, definitely the crown area is looking good. It's not getting worse or anything, so that makes me happy a lot. I'm gonna be blending here some pictures and photos when I'm kind of combing through that hair as well on a daylight as well, so you can much better assess whether it got better from the last month, or whether it's the same, or whether it's getting worse. I don't think it's getting worse, honestly. I think that it's probably the same, I would say, from my perspective. I do feel, however, that I got more shedding as a result of stopping minoxidil for like 2 weeks. I noticed it especially when I was applying my topical finasteride, and you know how it is when you're applying your topicals, you always rub it in, massage it, and this is the time when you usually, pluck some of the hairs more easily. And this was also my case, and right now it's not happening anymore. It was just a very, very short term shedding that I experienced. So that was pretty much it for this video, guys. Let me know what you think below. Now, for all of you guys who are interested in me helping you out during your hair transplant decision, or helping you out with regrowing your hair, helping you find out the right protocol for you, check out the link in the video description below, where you can learn more about how I can help you out one-on-one with my consulting services, and I will be happy to speak to you and guide you personally. That was it from me for this video, everybody, and I'm gonna be seeing you soon in another update. Take care.